All right. Well, welcome everyone. I am Lauren Gates. I'm host of tonight's Airway Health Solutions Conversation Series with our special guest, Dr. Nelly Silva, to discuss tonight's topic, airway and heart health. So welcome, Dr. Silva. It is a timely discussion being that it is National Heart Health Month. And I don't know anyone really with more heart than you. You know, you kind of put everything you have into something. And as soon as I met you at our Airway Health Solutions mini residency in over a year ago now, you've been on fire and have taken Airway really to the next level. So welcome. We're so thrilled to have you.
Thank you so much for having me. And I just find it so appropriate to be here because I'm all about heart. And of course, it's Valentine's Day month. So what a win-win all around.
And we had to wear red for the occasion.
Absolutely.
So here we are. So I'm just going to give you a formal introduction so everyone gets to know you a little bit, and then we'll dive in a little bit more informally to kind of find about your journey. But Dr. Silva is a graduate of Temple School of Dentistry. She is a diplomat of the American Board of Craniofacial Dental Sleep Medicine and a qualified dentist with the American Academy of Dental Sleep Medicine. She's a fellow in American Academy of Craniofacial Pain, and Dr. Silva is passionate about being a force for good in the community. And in particular, she is focused on improving the lives of young women by empowering them to grow in self-love, confidence, and resilience. Love that. Currently, she has 8 mentees from ages 15 to 22, and she's also a co-founder of Excel Learning Institute Dental Assistant School. She has been featured on NBC, CBS, and other media outlets. Dr. Silva's practice is called Advanced Dentistry of Collegeville in Collegeville, Pennsylvania, and she has been practicing dentistry for 18 years. So again, welcome. And let's just, before we get into all of this, let's just talk a little bit about your journey into Airway, because you said you've been practicing dentistry for 18 years, but I know I met you at our mini residency. How have you gotten on this journey? And now you're an American Academy of Dental Sleep Medicine qualified dentist.
Yeah. You know, it's interesting. My journey started, I guess, 2006. And I just happened to stumble into a sleep, an airway class. And, we were, at that time I was learning about cosmetic dentistry and things like that. And from there, it really grew and it's growing. And of course, when I was at your seminar, at your residency, I was so overjoyed because I'm going to save a little bit at the end, guys.
Yeah,
There's something I want to share with you, but it was sort of like that puzzle piece that I needed. So, yeah.
Well, we're so proud, and we're so proud to have you as an alumni. So,
thank you.
You're actually our first featured alumni.
Yeah, and you were saying something about American Academy of Dental Sleep Medicine, and I'm still on that journey. So I hopefully will sit for my boards for that, and I'm excited. Yeah.
Great. Well, before we dive in, just a couple of housekeeping items. We're going to ask you to please ask any questions you may have in the Q&A session, and just try to keep it topical to the conversation, or else we can be here all night long. And also, I'm just going to read a medical disclaimer because we do have a lot of patients who signed up for tonight. So I just want to make sure that we just are responsible in letting everyone know that the health and/or medical information is provided as an information resource only and is not to be used or relied upon for diagnostic or treatment purposes. This information does not create any patient-physician relationship and should not be used as a substitute for professional diagnosis and treatment. Please consult your healthcare provider before making any healthcare decisions or for guidance about a specific medical condition. Lauren Gates, Dr. Nelly Silva, and Airway Health Solutions disclaim responsibility and shall have no liability for any damages, loss, injury, or liability as a result of reliance on the information contained in this conversation series. Well, that was easy for me to say. That was a mouthful, but I think we have everything covered. I just want to be clear that, we're bringing this as a topical information that's actually geared towards more dental professionals. But Dr. Silva, I am so excited to hear what you have. I know you've been working on a great presentation, and I'm going to go ahead and give you the baton here. Why don't you go ahead and share your screen, and then we'll chat about this after.
Awesome.
Thanks.
All right, guys, thank you so much for your attention. Yes, so let's get right to it. I'm not moving. Why am I not moving?
So you're going to see the
There we go.
little
Yep.
arrows on the corner. Yep.
Yeah. All right, guys. So today I'm going to be speaking about proper assessment and diagnosing because we know coordination of care is integral in the preventive care of the management of hypertension, cardiovascular disease, stroke, and type 2 diabetes. An open airway is essential in the part of maintaining your healthy heart. All right, so here I had to put this picture here because I thought it was quite clever. You know, you have this big elephant in the room and you have all these other people in different aspects, and what they think they're holding on is actually not what they're holding on to, right? So, and they're blindfolded. I think that's a great example for growing in health and understanding the health system, because it's a lot to know, right? And really, in understanding that when we are in our own silo, we sort of get closed off a little bit. We lose the full picture of the elephant. So I thought this was quite fitting to share with you guys. Okay, so yes, I always have to use the American Heart Association, guys. Yes, they're the leader in sending information to you guys. So according to the American Heart Association, cardiovascular disease is the #1 killer of women, right? So heart disease and stroke can affect a woman at any age, making it vital for all women to understand their personal risk factors and family history. This is essential, especially, understanding advocacy, understanding what you need to have prepared when you are talking to your healthcare professionals, right? The World Health Organization states cardiovascular diseases is the leading cause of death globally, taking an estimated of 17.9 million lives each year. More than 4 out of 5 cardiovascular deaths are due to heart attacks and strokes. 1/3 of deaths occur prematurely in people under the age of 70. Now, I came here and I was talking about Valentine's Day, it's Heart Health Month, but really, besides helping my patients, this is my mom and my dad, yeah, and they're my heart. My mom I took care of while I was in dental school, guys. She had a stroke, but prior to that, my mom was diagnosed with GERD. My mom had, I remember reading her diagnosis, and she had a 25% ejection fraction. And simply what that means is not normal. Normal is at least 50 to 75. And she was diagnosed with GERD for the longest time. And I would argue that maybe something was missed then, right? So her history went on and on and on, and eventually she had 3 strokes, and my mom passed away at age 69. So that information that you read with the World Health Organization speaks to what my mom is, you see. So this is why this information is very important. So I'm a dentist, of course, I'm the doctor of the mouth. So I guess I'm supposed to talk to you about the mouth, but we really should be also looking about the heart connection, the GI, and also see how that spectrum includes airway. A lot of what I'm seeing is caused by many factors, and some of which is due to inflammation. One of the reasons why I think I got burnt out as a professional is that I just wasn't looking at everything holistically. There was not much joy in what I was doing. Today, I'm very joyous because I can give more to my patients. So when we're talking about assessing and we're talking about diagnosing airway, what are you seeing? My healthcare professionals out there, patients, yes, you come in, you complete a very thorough medical history, but it's very important to understand your history. So patients that come to see me will have high blood pressure, AFib, myocardial infarct, so some non-professionals in here, heart attacks. I had a patient that had 3 heart attacks. He's age 45, 3 heart attacks in a span of 8 years. And when I looked in his mouth, I asked him, "Are you wearing a Cpap?" He goes, "I am." I'm like, yes, because I'll tell you, as we go along, everything that we see as oral doctors is consistent. This is why I really love what I do. But yeah, so type 2 diabetes, congestive heart failure, insulin resistance, hypothyroidism, 40%, about 40% of patients that have been diagnosed with hypothyroidism have an airway component, and the literature is out there to show. And the list goes on, as you can see: anxiety, stroke, GERD, depression, and so on. Now, what are we seeing in our children? Hyperactivity, sleepiness in the daytime, misdiagnosed with ADHD, 40%, poor performance, memory problems, childhood obesity, I see this, abnormal sleep posture, aggressive behavior. These are the things that we see in our children. So I want to add that these conditions are linked to upper airway resistance syndrome and sleep apnea. I know in different communities, the thought is, they don't coincide, it's not a spectrum, but some would argue that it is. So we don't want to ignore that fact, right? So when we're talking about heart health, we want to understand that poor quality sleep impacts cardiovascular health. Sleep disorders is found to be 47 to 83% will have cardiovascular disease. Sleep disorders are found at 35% will have high blood pressure. So again, these are things that are very commonplace for healthcare professionals. I almost feel like almost all my patients have high blood pressure. I'm like, oh, high blood pressure, you know what I mean? So I think that's pretty common, at least in my office, I see that. Sleep disorders are found 12 to 53% of people, heart failure, AFib, stroke. Sleep disorders found 30 to 30% of people have diabetes. So I'm going to touch lightly about upper airway resistance syndrome. It was discovered in 1993 by Dr. Christian Guilleminault. And what he did was he wanted to study young thin people undergoing sleep studies, and discovery had happened. Some of these people had chronic fatigue, headaches, TMJ, anxiety. I would bet that a lot of our patients that we see in the dental setting have these as their health conditions. So as we go on, we're talking about sleep apnea. I think most people know about sleep apnea. So it's sort of, I'm going to go back. The AHI is just an index, it's just a way to measure. So we're looking at the total number of times that you stop breathing. More than 10 seconds per hour is typically how we measure. Apnea is complete closure. Hypopnea is partial, 30 to 50%. Drop in oxygen by 3 to 4% is how you can kind of vary the two. When we diagnose obstructive sleep apnea, one of the things I look at in, reading sleep studies is, is it mild, moderate to severe? That's sort of kind of how I see how I can play a part as an airway professional. Mild, moderate, 5 to 15, moderate, 15 to 30, severe. Now we're talking about different ways of treatment. So as I continue to learn and read a lot of literature, we understand that the reason why upper airway resistance syndrome is now being talked about is because it was always there and now we're seeing it. Yeah. So, and why are we missing it? Yeah. So because it doesn't meet the criteria of what we know as obstructive sleep apnea, apnea or hypopnea. We see an increased resistance in the upper airway. Basically, the upper airway is the nose to the back of the throat. We see an increase in respiratory efforts and arousals as we sleep. We see it quite recognizable actually on sleep studies, but I think some people sort of miss it. But if you look at it closely, you'll see that that there's a way to measure it. Certainly, you would do it in lab because you want to use the EEG to evaluate that. As well, because you want to see how fragmented sleep occurs. And some of these, and the classic signs that we find is mouth breathers. And this is why I think as an oral doctor, I'm able to see these characteristics far greater than someone that doesn't look in the mouth as often. Most of these patient population will also have chronic mouth breathers. So those are also another sign of evaluation. Okay, so I saw Dr. Jasmine Elmore's presentation, Upper Airway Resistance Syndrome. You did an excellent job. And I thought, how clever, this is so fitting. I'm gonna add this here. So credit to Dr. Roger Price. Why are you telling me that this is, why are you telling me this? You're just a dentist. Yeah, just to be clear. And I hear that from my patients all the time. That's why I had to put it in here. So yeah, You're not a doctor. Why are you talking about a medical issue? Why does this have to do, what does this have to do with my dental issue, right? So we talked about the elephant and being blinded. You see, I think that's sort of how we kind of have trained our mind, dentist here, doctor there, nurse there, just know what you know. And when you don't know what you don't know, then you really can't help anyone, let alone only knowing what you know. And I think that's, part of our handicap as far as helping our patients. Have you specialized in this field, and why are you stepping out of the area of your expertise? I would argue that it's not, you see. So I spoke to some other healthcare professionals, over 200 medical professionals. And I said to them, I said, listen, I've come in peace, right? I am just here to share with you what I see. And really, at the end of the day, I want you to be thinking about ABCD. I heard ABCD somewhere. And I tell you, I say this every day in my office. ABCD. Before anything else, I have to value your airway. And you value airway as soon as you wake up in the morning, right? You just do it naturally. So if I don't take that into account, how can I help you? So I have to really put that high on the list first, right? And then I just came up with this. Ain't that the truth? Because every time I look at somebody's mouth, I'm saying to my assistant, ain't that the truth? You see, again and again and again. And patients look at me and they're like, wow, they are really in awe. They look at me, I'm like, I don't know. They look at me.
I love it. I love it.
They're like, you're a superstar. You know that. I'm like, I do. So ain't that the truth? A, airway, I, inspiratory resistance, right? Or inflammation, because that could also go hand in hand. Nervous system, we get wound up, everyone has a varying degree. And tongue tie, always tongue tie. I can always find 1 + 1 is equaling 2 every time, right? They go hand in hand. So, and upper airway resistance syndrome, we're talking about sympathetic overdrive. This is something that happens at night and it still happens during the day. So we see these patients wound up, and that really is a summary and a quick way for anyone to kind of think of what I'm talking about. As we go on, you'll see how all this comes together. So when I was talking to those healthcare professionals, I said, listen, you talk to your patients, don't you just sit there and kind of look at their face? You should be able to look at these external characteristics and see what you would expect in the mouth. So you literally just shaved 1 second or maybe 1 minute off as you're gathering your information to diagnose your patients, right? So yes, what are we looking for? We're also looking inside the mouth. We're saying, oh, stick out your tongue and say, ah. And then we're putting all of these puzzle pieces together for that patient. And even though patients may not necessarily have a occluded airway, we also want to consider some other points. But typically patients that are occluded airway in that 3 to 4 scale, of course, they're going to be our red flag patients, right? So it's very important to look at the anatomy. We're always looking in our patients' mouths. Okay, so why is this important? Stop, bang. I remember my pulmonologist, my referring colleague, he says, yep, stop, bang. Epworth, I like, but stop, bang. Okay, stop, bang it is. And so really when I screen my patients, I screen every patient, I look at the airway and I ask them these questions. I said, red flag again, I would make a recommendation, and this is information for you. You do with that with what you want to, but I would caution you that this is a serious matter. Okay, this is an actual patient of mine, okay? He gave me permission to show half of his face, right? But what do I see? 1 + 1 is consistently 2. Well, in his case, 3. Not all the time do I see a restricted nostril. Sometimes they're open, right? So, but consistently, I'm looking at the palate, I'm seeing it vaulted. I'm looking at the tongue, I'm seeing it tied down. And I'm looking at cone beam technology and I'm evaluating the nasal anatomy, the tongue space, and the vaulted palate, all of it. And really that's what I show patients. And, I show them and I say, you see it? And there's no debating that, right? So I'm going to continue on here. So yes, one of my referring colleague, cardiologist, Dr. Shazad Malik, he might be here. I said, wow, he's coined a term. He's a daredevil. You changed the whole name of cardiology.
Love it.
Don't tell anyone. No, I'm kidding. But I said, this is clever. Cardiology, you see, it's the mouth to the heart, and the heart is channeling to every aspect in the body, right? The cardiovascular system is the highway to the other systems of the body. Airway, airway, airway. Not saying that everything is airway, but we must not forget that. We have to evaluate it in order to give our patients the care that they deserve. So of course, now we're going to transition into coordination of care, right? Because back to the elephant in the room with the blindfolds, you take off your blindfolds and now you see what I just told you. I talked to 200 healthcare professionals. I said, I'm not asking you to change your workflow, but now you take your blinders off. Now you see, you can't deny it now. You saw it, man. I know you saw it, right? But we are encouraged as doctors of the mouth, as airway professionals. I'm super excited and supercharged to be part of this community because we should be encouraged, okay? I was at a dental conference and I heard the World Health Organization and the federal, my notes, I have to find it, Federal Dental International, okay? They're talking and the World Health Organization is asking more information about proper health dental care, you see? And pretty soon, as you start to find out and ask questions, the airway thing will come up. So I'm really encouraged about that. So as we're talking about coordination of care, I do want to highlight this because then we're talking about cardiovascular health, right? So postural orthostatic tachycardia syndrome, a patient came in tired, thin, long face. And of course, hey, you know, I'm thinking in my head, I look inside the mouth. I said, do you have a physician? No, you don't have a physician? Okay, so let's get an airway evaluation. Okay, guess what? She was diagnosed with postural orthostatic tachycardia syndrome. You see, you know, that's bigger, right, than what we normally would see someone put on, or, you know, you wouldn't have that on your medical history or your medical form. But anyway, this is just an example. You know, some of these patients that can have the presentation of the oral anatomy that we see in airway constricted patients. Now, I do want to note that I'm not here to say that airway is everything. You know, I drank the Kool-Aid, but I'm not, you know, this is evidence-based, guys. So the reality is there are patients that are going to mimic, like this, I use this as an example, syndrome of inappropriate sinus tachycardia. You know, talking to Dr. Shahzad, he's like, yeah, you know, it's very similar. And yeah, you know, we would treat them with hardcore, you know, intervention. Oh, but they don't necessarily manifest with these oral presentations. So I said, oh, okay. Well, yeah, I remember when I was in dental school, I mean, we would go through every differential diagnosis and cross things out until we came up with a diagnosis. And somehow we kind of shifted from that. Again, we're going back to that elephant with the blindfolds, and we're sort of like kind of hanging on to different things, not necessarily clear on how to better help our patient. Okay. I would be remiss if I didn't put the slide on here, you know, because as an airway doctor of the mouth, doctor physician, whatever you want to call me, I think I'm more than the dentist, to be honest with you. No shade out there for my dentist friends, because when you're looking beyond teeth, okay, and you're establishing a stable foundation that's neuromuscularly centered, and you're helping the patient feel better, and you're getting patients out of pain, I am a doctor of the mouth, and I love working and coordinating with all my healthcare professionals here. So listen, you know, this is the path that you want to go. This is awesome, and be encouraged that this is going to be the direction in the future. Everyone that had a plasma TV, you know, it was expensive, and then all of a sudden, plasma TV, everyone had it. I think that's the direction that we're going. Of course, now you identify the professionals that you want to work with, then it increases your level of understanding what you can offer them as therapy. I believe that we're going through a paradigm shift. I believe that in the paradigm shift, we are going to decrease healthcare costs and improve quality of healthcare. Why is that? I think the reality is we were I probably, at fault, guilty of this, cognitive biases, great video to watch. I'll try to shorten it because I know time is of the essence, but this is actually a good depiction of what we should be very aware of. I'll speed it along too. Can everyone see that?
Well, some of it may not be.
Hold on, sorry. Hold on.
65.
Okay.
Is recalled the best and thus has the greatest weight given to it. There are three other common types of cognitive bias I want to focus on. First is anchoring bias. This is when a clinician places excessive weight on a specific feature of the presentation learned early on and determines the probability of diagnostic considerations based on how strongly they are associated with that one feature. This is similar to confirmation bias, which is when a clinician places excessive weight on a specific diagnosis and determines how much weight to place on subsequently learned information based on how much the information confirms that originally suspected diagnosis. So information that confirms the clinician's initial hypothesis is accepted, while information that refutes the hypothesis is relatively discounted. And last is momentum bias, also known as diagnostic momentum. This is when a clinician prematurely accepts a diagnosis as accurate that had already been attached to the patient without being adequately skeptical or without reaching his or her own conclusions. To see how these biases and a few others might play out in real life, let's look at a reenactment of a scenario that I've seen as a hospitalist. Imagine a 65-year-old man with a history of diabetes and anxiety who was brought to the ER by ambulance after developing difficulty breathing during a family argument. When the paramedics drop him off, they communicate the patient's symptom and medical history to the ER nurse, along with his vitals and whatever treatments were given en route. They conclude their sign-out process by saying to the nurse, given the situation in which the patient became ill, his lack of chest pain, and his history of anxiety, his breathing problems don't seem to be cardiac in origin. Probably just needs a Xanax and some rest. The ER nurse proceeds to conduct her own assessment, retaking the history and re-examining the patient. While doing so, even if she's consciously trying to stay as objective as possible in reaching her own conclusions, in the back of her mind, she still may be thinking, probably a panic attack. She performs an ECG on the patient, which looks for abnormal heart rhythms or signs of a heart attack, and then brings all that information to the ER doctor. The nurse tells the doc the patient is a 65-year-old man with bad anxiety and some diabetes, who was in a heated argument with his daughter during which he developed shortness of breath. He has no chest pain, vitals are stable, and on exam, he just looks anxious. It seems like maybe a panic attack. Here's his ECG. It looks unremarkable. At this point, the ER doctor also interviews and examines the patient, confirms the patient has no chest pain, and the doctor takes note of the unremarkable ECG. The doctor is thinking about the possibility of a heart problem, but thinks to himself, without chest pain and with a reassuring ECG, his breathing problems are probably not from a heart attack. And he's also thinking about the patient's history of anxiety, which supports the initial theory of a panic attack. Some of this is conscious, deliberate thought, while some of it may not be. The doc tells the patient, we aren't sure what's making you short of breath at the moment. It could be a heart attack or anxiety or something else. We're going to be doing some tests to make sure it isn't something serious. The nurse then draws some blood for these additional tests. An hour later, the nurse informs the doctor that one of those blood tests is abnormal. The patient has a modest elevation of a heart enzyme called troponin. There are many causes of an elevated troponin, a heart attack being one of the most common. The doctor now thinks to himself, well, yes, the troponin is elevated, and yes, that could be from a heart attack, but it's a very non-specific test with lots of other explanations.
Okay.
Nothing else.
Oh, let's see. How do I do that?
Hi, Nelly. Sorry, I'm joining a little bit late.
Hello, Dr. Shazan. Welcome. Yes, so let's get back to our slide. Okay, so next, the paradigm shift. The next paradigm shift is healthcare hierarchy. I just love my other healthcare professionals that I work with. And I say professionals because, who cares if I'm a dentist? Who cares if, Dr. Shazad is a cardiologist? We are teaming up to partner to help our patients. And it has nothing to do with who trumps who, or he knows more than me. I come to the table with, being that part of that elephant, right? I'm in my zone. I know I'm staying up on what I need to stay up on. I'm asking Dr. Shazad the questions that I need to ask, to support my patients. And he clarifies things that maybe not necessarily clear on. So I think, by having that connection and that partnership, you remove those cognitive biases, right? And you can help the patient better. So I think the next paradigm shift is comprehensive care. We owe it to our patients to partner up with all our healthcare professionals to understand enough of what we need to share with our patients so we can give them the right information. I have to share with you this video. It's pretty cool. I was on my way to, see a patient. I got paged to do a hygiene check. My hygienist is like, Dr. Silva, come see this patient. He's wearing a Cpap. He wants to get an oral appliance. I was like, really? Okay. So I go see him, and I want you to see this video. It's pretty cool.
Right.
Hey guys, here is Kat to share his news. I'm excited.
So it all started here in, I think, 2017 when Dr. Nelly asked me if I had ever had a sleep study done, and I said no. So after that, I went ahead and started to meet with other doctors, and it turns out that I have heart disease, and I end up having to have this input in. So it's a pretty well journey here.
So of course I wasn't excited about his heart disease. I was excited that I didn't even realize that I was part of his journey. You know what I mean? Sometimes we forget about these things. And look at him, he's 42.
Wow.
So, all right, I guess for me, it's sort of like the diagnosing, understanding the assessment part of it, understanding the coordination care of it, and now understanding how can we help our patients? How can we be their advocate? So I want to leave you guys with some questions to think about, not necessarily something to share, but really with this information, understanding the cognitive biases that we may not even be aware of. Do you have a patient that fits this mold? You see the medical history, right? And you're like, oh, they have high blood pressure, you're on the medication. It's not so much about meds anymore. It's really digging deeper. So think of the patients that fit these characteristics, and then think about how you can help them. Maybe you don't want to necessarily change your workflow, which is fine, but now you know the professionals that are part of this team. How can you partner with those other professionals and get the patient in the right hands? So I'll leave you with that. And
guys,
I won't let you watch the video again.
There
I know it's great. I don't know how to get this. This is cool, but
I end up having to have.
you go.
yeah, and that's a good way to wrap up. That's my family, and I love what I do. You see my big cheesy smile. It's because I can help my patients. I assess them, I coordinate their care, I give them the best treatment options, and we make things happen. So that's the wrap, guys.
Well, you're such an inspiration, and you make it look so simple. Dr. Silva, I know you put a lot of work and a lot of studying into this, so you have that confidence, and you come to the table, well prepared. Maybe you could give advice to someone who's just starting out, because let's say you said you started this in 2006. So it comes so natural for you because you have all this experience. You want to give some advice to maybe this is someone who's first hearing about this?
Well, I want to tell you to be encouraged. Just the news I heard at the board meeting, at the board of trustee meeting, and I heard WHO, World Health Organization, is working with the federal Dental International to understand how to help or improve dental care. Okay, you care that much, right? Okay, so now that tells me that we're moving in the direction, because as soon as they start to ask these questions, more things are going to come up. As you see, I showed you looking at the oral tissues. Now that you saw that, you will start to see that in your chair. So I will encourage you, certainly the mini residency is a great way to start. Certainly it's implementing it one thing at a time. So I think be encouraged, start to network with other healthcare professionals, and I think you're on your way.
Terrific. And a doctor wants to know, how do you like to bring up this topic with your patients when they're not expecting it from their dentist? Is there do you have a go-to way of bringing this up?
Well,
I think those acronyms like you mentioned.
I use those acronyms after I screen them. So, of course, you're going to look at their medical history. I see that you have hypertension. Like, how long have you had that? That's your basic intro. And then you're looking inside their mouth. I'm noticing this, I'm noticing that. Have you had a sleep study? What are you talking about? That's a quick way to intro. And then you say, listen, I don't want to overwhelm you. I know you just came here for your tooth. How about I just give you this information and we can always chat about it. So it's just really kind of coming from a caring place.
And how involved are your hygienists in your office?
Oh, very involved. Yeah. Lauren, she's like you.
So I'm just saying, it's to me, it seems so important to have that step. It's such a logical step because they're the first ones to really, patients coming in for their routine cleaning, as they coin it. And, the hygienist is with the patient for 45 minutes to an hour. How do you have that handoff? You want to share? Because I know a lot of people want some tactile.
Oh, sure. The handoff is really great, especially when the person handing to is speaking with power and confidence. I think, whoever is your hygienist has to really be passionate about it, because no offense, there's some hygienists that just want to clean teeth, right? So I think it starts really with that person linking it also to soft tissue, because if the mouth is open, that's going to be a bloody mess. I would guarantee you that. So that's another way to kind of lead that in.
Great. And a question just popped up on the chat. Do you send your patients off for a sleep study in a lab or a home sleeping test?
Great question. So, I actually work with several sleep doctors, pulmonologists as well. And I also refer out to outside companies, because the reality is these doctors are really busy. So I think really the standard is home sleep test first, and then depending on what's found, they will do a polysomnogram. I think that's typically what is happening. I don't know if it's different elsewhere, but that's how I do refer patients out for airway evaluations. Yes.
And how do we as dentists help patients reduce their risk for coronary and heart disease? What statistics can we share with them that is related to dental conditions and helps to demonstrate the importance of dental care? Do you share those the AHA statistics?
I don't necessarily share that with them, but I mean, that's certainly something that you can share with them. I think even in dental school, like I remember C-reactive protein and, the mouth. I mean, I think patients by now know the mouth is linked to the heart. So at a basic conversation level, that can be used. And then you can elevate it by saying, yeah, by the way, heart disease is a number one killer. And I see your medical history, not that I'm trying to scare you, but maybe perhaps you look into this, or I don't know. But for me, some of my patients don't have a physician. I'm like, why? So, I think that's a good way to, set them on their way too, and say, you've indicated you have medical history of hypertension, and now you're saying that you don't have a physician that you see. Maybe perhaps we evaluate this further. Maybe perhaps you see the pulmonologist or the sleep doctor for an airway evaluation, and maybe perhaps we see how this could be, corrected in such a way. So, I mean, you can have these conversations with people, and little nuggets here and there, and eventually you kind of listen to. So I think that's always a good way.
Right. And you speak with such conviction that definitely helps as well when you're saying the confidence and the passion. There's no substitute for that. And it does take time. Just like when you got out of school and you're talking, or your hygienist talking about your non-surgical periodontal therapy, it seemed like so foreign until you talk about it daily. And then it's just like your regular dental lingo. So really important. How can mild obstructive sleep apnea be corrected without a Cpap machine, in your opinion? This is from a chiropractor.
Oh, great. I love chiropractors. Hello, chiropractor.
Dr. Silva.
Wait, really?
Mm-hmm.
Wow.
Yep, Joe Silva. I don't know if there's any
I
relation.
don't know if we're related. My husband's last name is Silva, but that's kind of cool.
Okay.
So Joe, the answer to that is, I mean, I've worked with chiropractors too. So you're sort of correcting the posture because there's a tendency to have a forward head posture. Certainly that is indeed the case during the day. At nighttime, I find that my referring doctors, or the doctors I refer to, my sleep doctors, they're totally on board with oral appliance therapy, you know. And of course, you're going to have patients that you talk to that have, you know, you look at their nose, they have a deviated septums, you look in their nose, they have inflamed turbinates, you know, and then you're going to talk to them, hey, maybe you might want to consider seeing an ENT doctor. So it's sort of like understanding how airway works and of the limitations, then you can kind of pepper in little things here and there. But yes, an oral appliance therapy certainly would be indicated for someone with mild sleep apnea.
And have you used the Airway tool on a CBCT?
I love the Airway tool on the CBCT.
Can you explain to that for people who may not know what that is?
Let me see if I go back. Because it's so cool. Like once you show patients color, they get it. I had this one patient, I left the room, I went to go review her CBCT. I go, are you okay? She's like hunched over, like the chair was back, but she's literally hunched over. She goes, I can't breathe. I go, I can see why. Guys, her pharynx was completely red. Like it was the skinniest straw ever. So, you know, you can show patients something like this and say, hey, do you see that that's green? But the key point is you're standing up. I mean, okay, granted, I want to tell you guys that I tell my team now, no more bite forks to take it, because really you're kind of changing the tongue posture a little bit. But for the most part, you know, when you take an image with someone standing up like that, you can show them the color and they get it.
And so you use it as a diagnostic tool and as a consultation tool.
So I don't do it as okay, well, let me take a CBCT on everyone. So what I do is I do screen them and then I say, hey, this is your next step. And then when they come back, this is part of the process. So I do take it afterwards, but at least I do show them at that point.
Wonderful. And you feel like there is a reaction, right? Do you see
Oh
it
my goodness.
Yeah. It's an emotional reaction as well, correct? Does having an ongoing issue with congestion affect your heart health?
Well, let's break that down a little bit. Congestion, we're talking nasal congestion, I would assume.
I'm assuming it's just,
I'm assuming.
yeah,
when I saw that, I said, okay, I'm going to assume it's nasal, right? You know, with this, even with this patient, you look at his nostrils, one's actually smaller than the other. And you understand when you see that with a vaulted palate. I think I learned this from you guys, you know, when the nose is, when they're vaulted, right? I mean, come on, this is pushing up into that space. So the tissues that are in there have no room. So, and then if you're a mouth breather, those tissues are now swollen. So how could you even breathe? So imagine trying to breathe through this tiny little straw. Of course, you're going to end up having some of those characteristics that we see with upper airway resistance syndrome. Of course, could it be, you know, some camps say it progresses to sleep apnea. I mean, if you're having fragmentation in sleep and your brain is being aroused, I mean, your brain function, you're wired up. I mean, eventually something's going to give. That's basically how it happens. So maybe potentially down the line, you're gaining weight. You know, we know ghrelin and leptin, they like to kind of go crazy a little bit, and you gain weight because ghrelin goes out of whack, right? So maybe potentially down the line, we end up having cardiovascular, I don't know, but maybe it's
just connecting the dots, right? It's maybe not causal, but you can certainly correlate it.
Sure.
Do you have specific visuals that you use with patients so they better understand what you're explaining about with airway and heart health?
Yes. So not necessarily heart health.
Mhm.
I think the heart health communication is really just painting the picture.
Mhm.
But I love the airhead. The airhead is a flat little guy that has like the depiction of the hard, soft palate, and then it
Okay.
has the movable jaw, and then it sits forward when you put the oral appliance type shape in there. So I like that. It's called the airhead. I do have a kind of a sagittal view of a head with the nostril to show the nostril into the turbinates and all that. I use that if I have to. And of course, you know, if I'm talking about patients that come in with jaw pain and dysfunction, I'm pulling something else to show what the disc looks like, and the elastics is the muscle. So, I mean, it really depends on what I'm talking to the patient about.
But it's important. The visual aids you find important, correct?
Oh my goodness. Yeah. So
I always say
important.
show and tell, show and tell.
Show and tell, honey. Ain't that the truth? Lauren, ain't that?
And co-diagnose, right?
That's right.
Okay. Do you ever suggest surgery for sleep apnea or implanting devices to help sleep apnea? I guess it's
Great.
two
You
questions.
guys have some great questions. Listen, okay. I had this one patient. He's the funniest guy. Like, I feel like he has a lot of money. He's like, Dr. Silva, he pays me cash for an oral appliance. I'm like, dude, you have to come back for follow-up. He's like, no, I'm just trying to check the box. I want to get the Inspire. I'm like, okay.
Oh, no.
You know what I mean? So like, there's some people that just have their mind set on something. So, I mean, come on, the reality is some people that wear glasses don't want to wear glasses, right? So some people want to wear contacts. Now people get LASIK. So, I mean, it really depends on what you want to have. So given that, you are going to talk to your patients about the possibilities. I had this one patient, she came in for an Invisalign consultation. I kid you not. And I'm like, you know, she was presenting like, I want this and I want this. I was like, okay, I'm going to give it to you. I was like, you know, I just want to, you know, kind of share with you that your chin is a little set back and you got this really deep crease and you're getting some lines there. I know you want to just align your teeth, but maybe perhaps we consider expanding the floor of the mouth, of the nose. So then we have proper alignment, and she's down for it. So I'm having this consultation with my oral surgeon, and
Wonderful.
that's who comes in play with now expanding. So could that be considered, I don't know, LASIK surgery? Because at the end of the day, an oral appliance, I think of it as like wearing bifocals, you know, I mean, glasses. And of course, you think of the oral appliances as having different profiles. Like Lauren, you have a little bit of a clunky glasses, right? It's trending. You know, that could be characteristic of a specific type of appliance. Some people like to wear the little, you know, cat eye glasses, you know, a little smaller profile. So it really just comes to the language that you share with your patients. Hey, there's so many different glasses out there, right? So it really just comes down to which one fits your face, really which one fits your mouth, and we can take it as far as you want to go. Clearly, what we see with patients that have an airway issue or constriction, their teeth are crowded. So, you know, we can take it to the extreme if you want to. We can even do veneers, you know, after we've established a nice home base for your airway.
Wonderful. Are there therapies that are helpful to help discontinue the use of a CPAP?
Well, you know, there's studies out there that talk about, you know, after a year, most patients sort of kind of give up with CPAP. And of course, you want to get them into something's better than nothing. Again, it really just comes down to how you pepper things. You know, Inspire is an option. Really, there's a criteria there for those types of patients. You know, it really just comes down to the patient. You know,
Right.
we talked about the disclosure before I started talking. And again, every patient is different. You know, a small person can have the smallest airway. You think it would be like a wide open goalpost, but yeah, it really just depends on what you're kind of looking at.
And do you feel MDs and cardiologists are gaining this awareness? So I know is Dr. Shahzad, is that the cardiologist you work with? And
yeah, he's one of the cardiologists I work with.
And I welcome, I didn't know you were going to jump on, or else I would give you a formal introduction.
No, I apologize. I feel like
no, that's okay.
I'm
I'm
bombing
glad to
the
have
video
you
here.
That's okay, Dr. Malik.
I'm so happy to have you here. So I don't know if you want to speak to that, since you both work together. That would be wonderful.
Yeah, so I mean, it's kind of crazy. I mean, I was sort of exposed to this a couple of years ago through my wife. She's an airway dentist, and then through my wife meeting Nelly, and she's a dentist who studies the airway and is practicing airway medicine. I mean, we never as cardiologists, this is not something that we're trained to think about, but now I spend probably half my time looking into people's mouths and looking at the anatomy, making the connections, diagnosing sleep apnea, and then referring to my colleagues for treatment, or even treating the patients myself, either through Cpap therapy, oral appliance therapy, Inspire therapy, or a very new burgeoning field of therapy called oromyofunctional therapy with tongue tie release. That's something that I've been very interested. I've been researching that topic a lot in the last few years. I actually just came back from Las Vegas a couple of weeks ago, and I presented some internal data from my office talking about the role of mouth breathing in the cardiovascular population. Of course, I was talking to a friendly crowd. They were all very motivated airway dentists and oral myofunctional therapists and SLPs and ear, nose, and throat doctors. There was no cardiologist there, so except for myself. But basically, the connection is obvious now. Cardiovascular disease is being diagnosed more frequently than any disease entity in the last 50 years. And one of the most foundational links is the airway. Wow. And I mean, it sounds extreme when I talk about it. I've been, when I talk about it with friends or family, they're like, wow, you come a little bit too hot and heavy on this topic. You got to relax. It has to be more than that. And the answer is, when you develop cardiovascular disease, or if you develop cancer, or if you develop autoimmune disease, or if you develop any risk factor for cardiovascular disease like high blood pressure, diabetes, obesity, etc., the reality is there are several issues going at hand. There is obviously a nutritional factor, which is sort of the big elephant in the room. Mm-hmm. There's a fitness issue, which our friends in the world of chiropractic medicine can preach to that and tell you about that. There is the stress issue in life. We all deal with stress, and some of it deal with it differently, unfortunately, in an unhealthy way, and that we end up developing problems from that. And the last, and probably one of the most foundational, in my humble opinion, is the airway. Mm. And this is in the developed world. You will probably not see a lot of this in the developing world, mm-hmm. As much as you'll see it in the developed world. And we are living in an age of the average person having jaws that are ever so slightly smaller. Mm. And this has become a topic of, more interest even in the lay press. And there's books by James Nestor. He wrote the book on Breathe and the book Jaws, and all these books are coming out, but they're all based upon Dr. Weston Price's sentinel work back in the 20s and 30s. So it's funny that as a heart doctor, I'm sitting there, I can't believe I'm even talking about such things because they seem so out of view for me, but they are really now becoming at the heart of the matter. And I can tell you that when I see a patient, I cannot tell you how many times they have a problem, and all you need to do for the vast majority of them is look into their mouth, ask them a few questions, take a few measurements, send them for a sleep study. And they're shocked when the results come back, but I'm not. And it's fascinating, but the connections are clear. Yeah.
Dr. Shad, thank you so much for sharing. This is like a treat.
I appreciate
that. Come back and have a whole conversation just from a cardiologist view. I love that. And so maybe I'll reach out because we had a lot of technical questions that, really should be answered by a cardiologist. So I'd love to have you as a guest. If you would give us the honor, that would be wonderful. So
it would be my pleasure and my honor. Yes, absolutely.
Thank you. Let me see, Dr. Silva, how can one identify dental patients with the airway problem? Let's talk about hygienists here. We have a lot of hygienists and SLPs on board. What is the most simple way? I know you showed us the facial profile, the vaulted palate, everything you see. You just want to put it in a very simplistic order, if you would.
So the most simplistic order for me would be, for the most part, we're taking x-rays, we're looking inside. So again, that is a quick look in. And that you're formulating kind of how you're setting the tone. You've reviewed their medical history. So now you're linking, hey, I see, that you have these extra protuberance in there. That's called tori. I see that your teeth are leaning in. I see that your medical history includes AFib. You've had a heart attack. Has anyone ever talked to you about, a sleep study? Have you had one? Do you use a Cpap? These are just questions to kind of dig a little bit. And then, you tie it in with the gums. I don't know. For me, patients come in to get their teeth cleaned. If you're coming with the bleeding gums and you're seeing these characteristics that I've showed you, it has to be that the patient's mouth breathing. You know, how many products can you throw at the patient? The reality is, let's stop for a second and let's take a closer look and let's have those conversations, because it's nothing like, you know, you're going to, you're telling a patient to get a water pick, an electric toothbrush, and this patient is using these things and not getting any improvement. It's kind of, you know, it's just not motivating. After a while, the patient gives up. So I think if we're looking, like Dr. Shahzad said, you know, in his field, it's airway. In my field, it's airway. I mean, it's you have to establish that first.
Well, I also want to talk about, you have a book coming up. I'm so excited. Better Health, Nutrition, Airway, and getting, what is it, getting?
A good night's sleep. Dr. Malik.
Excellent.
Yeah, Dr. Malik wrote he's a contributor as well. And we've had other contributors, and thankfully, the book is going to be amazing. And really, I think I can speak for myself, and I think Dr. Shahzad would agree as well. Every healthcare professional institution should have this book.
Absolutely. Well, I can't wait to share it.
Yes, I'm excited to share it with you.
I'm just going to go ahead and share my screen for some updates, because I always like to share what's coming up. And again, I know you were one of our graduates, and actually you're on our video of a testimonial that literally you said, I took this course, I'm going to give my treatment coordinator this book, and I'm going to like implement it. And that's exactly what you did. So thank you for that. But we do have a couple of seats left, 2 seats left for our pediatric mini residency, and about 6 seats left for the adult on March 18th. And then we have plenty of openings in May, and of course in September. So please, if you're interested in becoming an airway dentist, please go to airwayhealthsolutions.com, and you'll see all our courses pop up there. We're so thrilled to have Dr. Kevin Boyd join us, and he's going to be specializing in early childhood. And we have actually Dr. Darius Logmany as a special guest with our live course, April 1st and 2nd. We do have 3 spots left. The hotel is booking up quickly at the Diplomat, but we have room for virtual attendees. So please reach out to me or visit our website directly for more information on that. We're really excited about this course. We're also thrilled to bring Dr. Michael Gelb on board on faculty just recently. And this is kind of a niche course, if you would. It's really specific on treating the TMD patient, the prequel to airway to ortho, because ortho is the solution. So Dr. Gelb and Dr. Moralia have worked together over a decade, and Dr. Moralia has had the luxury of referring the TMD involved patients to Dr. Gelb, and has had wonderful results where he finished up with the orthodontic treatment, usually with expansion appliances and clear aligner therapy. So this is a one-day course, 100% virtual. We are offering a courtesy that I'll send you in the email, but if you want to go right now and sign up, it's airwayhealthsolutions.com/Gelb, and we have a courtesy code there, AHS Gelb, $200 courtesy. And we have our advanced mini residency with Dr. Ben Moralia on expansive ortho for teens and using fixed expansion in older children as well. So it's bracket and wires with an expansive technique. This is really a must attend course for the next level to have more tools in your toolbox. That's June 3rd and 10th, and it's 100% virtual. If you really want to get patients started, reach out to me and we can send you a recording before that course. We are mad about Mayo, and we have our March Mayo Madness special, easy for me to say. Go to airwayhealthsolutions.com. We actually opened up new courses for existing myofunctional therapists, RDH OMTs, to take our course and integrate different modalities. But if you're a hygienist who really wants to dive into airway, it's part of your scope of practice to do myofacial functional therapy. So check us out. We have a couple of seats left for our next course, which is March 4th and 11th, and then we're running it again in September. So that's coming up. Some people love live learns, like I can't wait to get back to live next month, but we do have 2 live events in July, and then also December of 2022. July 6th through the 9th is the Dental Festival in Nashville. We're having a whole day conference, Airway Health Solutions, on team building with Dr. N Team. Dr. Moralia and Dr. Boyd will be there, and myself, Rachel Smith. And then the Clear Aligner University, we're also having our myofunctional therapists attend. So it's a great day of Airway and clear aligners and a lot of fun as well. And then save the dates for December 1st through the 3rd. We're having an Airway Palooza where we're going to have really the top experts in the field come all together under one roof for a lot of great social events as well as top education. So stay tuned. We are filling up this map quickly. So once you take our course, you can become an airway dentist. And I have so many patients that refer to this daily. I get asked all the time, where can I find an airway dentist? So once you take the course, you'll get a green dot and patients can find you as well. We just started a public Facebook group. So please reach out if you're a dental professional. It's specific for dental professionals. Please reach out to me at facebook.com Airway Health Meetup. We thought it was good to just have a dental specific group to focus on dental specific airway issues. And then our next Airway Health Solutions Conversations is Tuesday, March 15th with Dr. Michael Gaub. Dr. Ben Moralia will be with us as well, and Dr. Hal Stewart. So we have Dr. Susan Maples coming up in April, and we just love doing this. We always have a great turnout. You guys have such great interest, and we always get great questions. So we thank you. And Dr. Nelly, you can reach her at Instagram at dr._Nelly. You're always very social there. So check her out there. And she's in Collegeville, Pennsylvania. I hope you're on our dentist locator, Dr. Silva.
I am.
Yes, okay. I was going to say. And if you have any questions, please reach out to me through info@airwayhealthsolutions.com, or you can catch me on our social media as well. Wow. Well, we're right at 9 o'clock. Dr. Silva, I can't thank you enough. What a joy to go full circle with you. I remember we hugged at the end of that residency. We had dinner, we had wine.
It was fantastic.
Yeah. It was a nice time. But really, congratulations on all that you do. You're so motivating, and your patients are lucky to have you. Awesome. And a special thanks to Dr. Shazad for joining us tonight.
Yeah, how impromptu was that? That was
perfect. I know. I didn't even know we could do that. So
it was a pleasure. Thank you so much, guys. Nelly did great.
I know people want to know where you're located as well, Dr. Shazad.
I practice in Allentown, Pennsylvania. So those who are familiar with Billy Joel, right? The song. So I live, although he was thinking about Bethlehem, but I live in Allentown, Pennsylvania. Yeah, that's right.
Great. Well, thanks again. It was a nice touch to add your opinion and your passion. It's very motivating, and there's hope, right? We're all collaborating together.
Oh my goodness, collaboration.
And Dr. Silva, why don't you close us out with a word of advice, just to you share that motivation and passion that you have.
Awesome. Listen, guys, we are in a community of excellence. So just keep up the great work. And I'm super excited to continue my growth. And I hope you do too. So that being said, I'm Dr. Nelly. I'm peacing out.
Okay. Good night, everyone. Thanks for joining us. We'll see you soon.